Good afternoon, everyone, and thank you for tuning in to our bi-weekly press conference on Delaware's response to the COVID-19 pandemic here in our state. And before we get into the presentation today, I just want to alert folks to an evolving situation there in the vicinity of the Delaware Veterans Cemetery, where there was a shooting earlier today. Delaware State Police and law enforcement are responding to the scene. They've established a perimeter around where the shooter is, and some neighborhoods in the vicinity have been evacuated. Very bad news as we start the press conference today. And Delaware State Police will be providing additional information as it becomes available. Really sad news to think of that kind of an event in what is really a sacred ground, the final resting place of the men and women who've served our country so valiantly, our Delaware Veterans Cemetery. I've been there so many times for Memorial Day and Day events and Veterans Day events, and been there for burial ceremonies as well. And as I said, it's sacred ground, and to think of a situation like that on that facility is just heartbreaking. Before we get into an update on the cases of COVID-19 across our state and our response to it over the past week and since the last meeting, I'd just like to emphasize and talk a little bit about the listening campaign that's going on. I hear a lot of feedback from people across our state that nobody's listening to the concerns that they have. We're not getting enough public input or feedback in the decisions that we're making. And I just want everybody to understand that, as I've said in each of these press conferences, that these decisions are not just being made by me, it's a team. We've got A.J. Schall here, again, a point person at the Delaware Emergency Management Agency, really doing a tremendous job working with the whole team, and Dr. Karyl, Rattay, the Director of Division of Public Health, and her team at the Department of Health and Social Services, and every state agency, from transportation to education to children, youth, and their families, to our law enforcement office, to our partner hospitals. So much has been going on, and all that input informs the decision that we are making on a daily basis. And as I've said for some time, the decisions that we will be making over the next couple weeks are more difficult than the decisions that we had to make as we closed down sectors of the economy in Delaware. These decisions to reopen in a safe and sound way, to reopen in a way that customers and Delawareans feel safe from the virus as they circulate once again more readily into the community, and to do so safely. It's so incredibly important. But we've also had an incredible campaign of public outreach. Our Lieutenant Governor has done a tremendous job over the last 2 weeks with 7 small business town hall meetings in geographic areas across our state. I'm told that 750 small businesses participated in those town hall meetings, and 1,200 others joined as well. And I listened to the feedback that we've got, and I heard and I hear the anguish of business owners from the beaches to the northern boundary with Pennsylvania, and from the Delaware Bay to the Mason-Dixon line on the western border. And obviously we are incorporating those comments, those suggestions, those assurances, that anxiety, that heartbreak into the decisions that we are making, and trying to balance public health objectives with the needs to get our economy going again. I've listened on those telephone town hall meetings, and I've heard the voices of business owners who've had family businesses over generations, whose parents and grandparents built those businesses, and who had hoped and hope still to turn those businesses over to their children. I've heard from businesses that really are the heart of the community in our state, and the things that we hold dear, the restaurant associations we talk to on a regular basis, and had our call this week, and the anxiety is growing, and I personally am conscious of that and factor that into the decision making that that's underway, and incorporating that balance between our objectives for public health. And it's really a simple calculation, right? As long as there's not a vaccine or an effective treatment, that the way to protect vulnerable populations, particularly our senior citizens and those where most of the over 200 deaths have occurred in our state, is to protect social interaction, right? Dr. Birx on the White House task force simplified it for me the other day when she said that if you just reduce by half the number of interactions, the number of times that you go to the supermarket to get food, or to the pharmacy to get things that you need, or for your prescription drugs, or go out for an essential function, that will enable us to contain the spread and being able to move back to a more or certainly a reopening, what we're calling a rolling reopening of our economy. And we announced the other day some interim steps allowing us to open small businesses that under certain conditions, and we've had quite a bit of feedback from that. And so we hear that anxiety. We're focusing on making allowances for small businesses in particular, so that they can do some business and get some revenue. We've had conference calls with the mayors of the coastal communities in Sussex County, the beach towns, and we have a lot of issues and decisions coming up over the next week with respect to the status of the beach communities, both in terms of the beaches themselves, visitors from other states, short-term rentals, and the like. And all of that depends on our continued ability to protect all Delawareans, to prevent the spread of the virus, and we're making progress there. That's the good news. We are being successful in flattening the curve, as they say, and we'll see some of that data in a minute. So at the same time that we're focusing on reopening the economy and reopening shuttered businesses so that they can get some revenue, so folks can circulate more in public, we also have a two-track approach to addressing a significant outbreak of the COVID-19 virus among poultry workers and others in communities in Sussex County. And you'll see that the positive cases in Sussex County have increased over the last several weeks. And part of that's because we have significantly ramped up the testing both in the community, in Georgetown and Milford and Seaford this week, and Bay Health and BB Hospital in Nanticoke are to be congratulated and thanked for their help in doing those tests. Bay Health has done testing in the Purdue plant in Milford and in the community there in Milford, and they've tested over 3,000 people at those two locations. BB has been doing several community testing sites in Georgetown mostly. They've done over 3,000 tests over the last couple weeks and are prepared to test poultry workers at the Mount Air plants and next week, and then Nanticoke as well, participating in community testing there in Seaford, and really just doing a great job with partners on the ground from La Red and Westside Public Health to La Esperanza and other providers there, Division of Social Services here, Megan Wallace and her teams on the ground providing care kits for families. We have a hotel that we've stood up there in Georgetown to help individuals who test positive for COVID-19 to self-isolate if they can't do so at home. So on the one hand, we're trying to put out the fire with testing in the plants and testing in the community and support for families, and protecting others from those that are testing positive, and certainly enforcing protections in the plants, and at the same time seeing improvements in those factors, criteria for reopening, and really listening to the small business community and others who want to go back to work, want to open their shops, and want to get Delaware's economy rolling again. And we need to do both. We need to do both sequentially. It's not a choice one between the other. It's we need to do both. And so let's work together. We're going to look at a dashboard of indicators and to inform our decision to take some interim steps to reopen certain businesses, to allow certain activities to be done in a way that's safe and that helps protect from the spread of the virus in the community. So the message is that flattening the curve is working. Now's not the time to let up. We've got a really challenging couple weeks with the return of the good weather and with the beach season, about the normal beach season about to open, and we'll be making decisions there informed by the situation on the ground in terms of number of positive cases and hospitalizations. We'll talk about that in a minute. So here we go. We're over 6,000 positive cases, over 200 total deaths, and again, vast majority of those deaths are in the health compromised population of senior citizens. Importantly, and the issue or the indicator we really are looking at is that current hospitalizations, and it is below 300 again. It's kind of a target number for us, AJ, that we've been looking at to preserve any kind of surge capacity that we might need. We know within those numbers there are critical care units and ICU units, and we feel very comfortable about our ability with the hospitalization number there. And importantly, the number of hospitalizations in Sussex County, even with the increase in positive cases, is not trending up as we would expect. And our hospitalization rate as a percentage of those testing positive is actually trending lower than our estimates, and that's a really good thing. So 2,100 cases still rising in Newcastle County, but flattening out, particularly as a percentage of the tests being done. 963 cases in Sussex County. All of this information, by the way, you can get on the My Healthy Community website, part of our de.gov/coronavirus website. And then here's the hotspot back in Sussex County, almost 3,000 positive cases. Again, really ramping up the number of tests there. It appears that we're not getting quite as many positive tests, positive cases as we might have expected early on. That could be a good thing. We're really watching that trend. And again, the hospitalization trend, which continues to be in our favor. Cases by age, this distribution is pretty consistent through the last 2 months. Again, you still see a little bit of an uptick there in teenagers, children, but again, as a percentage of the total, not a big number, always of concern. So here's the dashboard. Here's part of the dashboard, the criteria that we're looking at to start to feel comfortable about moving to reopen the economy. And some of that you may or may not be able to see. Again, it is on your My Healthy Community website on the de.gov/coronavirus website. That's a 14-day view. So we look at these in 14-day intervals. We want to see everything moving down on average. You see the unevenness in the new hospitalizations there, the second graph at the top, and the unevenness in the new positives, even with a 5-day moving average on the bottom. The little uptick there represents the new cases. That's the bottom left, the cases that we're seeing in Sussex County. But overall, trending down. Current hospitalizations is the top left, which is flat, trending down just a little bit, under 300, as I said a minute ago. And then The orange bar, which is the lower part of that bar chart, shows the Sussex County hospitalizations, and as I said, curiously, actually trending down a little bit, notwithstanding the uptick there. So the percentage of persons who test positive, again, is the top far right, and you see that consistently trending down, which means the percentage of those new people tested is the number of positives there. The percentage of those is decreasing on a nice trend line there. And then, of course, the bottom right will continue to trend upward. It'll flatten out eventually as the new cumulative number of positive cases. Not a real important criteria as we look to open, but just one to consider as we think back over the last 2 months. And then here's our data dashboard with respect to PPE. So in order to move to phase 1, you need to have basically all these bars in the green light territory. Right now, we have N95 masks in green light, face shields, glasses and goggles. The yellow light shield is the isolation mask and the surgical mask, and we hopefully can move those into the green category. The two areas where we've had some shortages of late is in the gloves and the gowns, and you can see those there. We want to light those all up in green as we move to phase 1. So as I've been saying for some weeks now, we need a healthy community in order to have a healthy economy. They're inextricably linked for sure. Folks are not going to go to businesses that are open if they don't feel safe in doing so, if they don't feel like the community is healthy, if they don't see others following social distancing guidelines, if they don't see others as they go to the grocery store and other places wearing their masks. I know myself, as I go to my grocery store, if the parking lot's really full and I see a lot of people inside, I'll go home and wait for another day just to be safe. And I think we all need to be thinking about that. Our ability to social distance will be a major factor in determining how much more we can do and how much restrictions we can lift to keep Delawareans safe. This will be a key criteria, and part of the reason for taking the interim steps is to see how they work and whether people observe the guidelines and we're able to keep people separate. I hear all the time, we see the big box stores that are open mostly because they can sell groceries. Why can't we? I'm a small shop. I can control my customers more than somebody at the big box stores, and that's true, and that's troublesome. It just is a function of the fact that they sell the groceries there, and we have been stronger in our enforcement on the number of people and the percentage of their fire code that they can allow into the store at a given time, and they do that. I was to the Home Depot last weekend to pick up some supplies that I needed and had to wait for about a half hour, 40 minutes because there was somebody at the front, appropriately by the way, and 6 feet separate from the guy in front of me. And once I turned around and reminded the guy behind me that he needed to have a 6-foot separation, we had it there as well. And there was plenty of room inside. But it requires all of us to work together to enforce those guidelines to, again, prevent the spread. So what are those conditions that we need to have to reopen? And again, we are going to continue to take these interim steps and to gradually reopen, as opposed to turning a light switch on all on June the 1st or May the 15th or whatever the date is. But we have to have conditions that are improving on our dashboard. We showed the data dashboard a minute ago. Things are looking really good over the 14-day trend. A little bit of concern about hospitalizations, which is flat statewide, but trending down in a positive direction. And of course, really watching that uptick. And particularly this week, because of the expanded testing at the poultry plants and in the communities at Sussex County. And by the way, I've heard that the fact that we are out at the plants doing so much more testing, that it's creating a level of confidence and comfort within those communities and across the county that we're making every effort to address that problem there. We need to have the expanding testing, and Dr. Rattay is going to talk about that. We had a big announcement today and a big win earlier this week with an announcement today on that, with a couple 100,000 test kits that we secured, which is really a great thing for all of us. We've got a plan for increased contact tracing coming together. I think we should have an announcement on that on Monday, possibly, with some partners there, and using the National Guard to help us get started. And then obviously you need to have adequate personal protective equipment. And this is an important one, because in our conference calls, both the Zoom town hall meetings and the other public conference calls that I heard Lieutenant Governor Long doing, and in my conference call with the restaurant folks, and in our discussions with the hospitals, the availability of PPE, which has been in short supply, and we saw the dashboard a minute ago, is critical to be able to move and to open businesses that are not open at the moment, that have employees that need to be protected, and so that we can make sure that the customers who are going into those stores or coming up to the curbside have their face masks on. So we're really making progress. We are flattening the curve. Everybody's efforts to pitch in has made a difference, and we're moving to a place where we can gradually reopen businesses that have been closed, and that's a good thing for the businesses and good thing for the employees. So today we're significantly expanding. We have been significantly expanding our statewide testing program. Dr. Rattay and AJ are going to talk about that. We're very excited about the developments there. And I couldn't say enough about my appreciation for the work of BB and Bay Health and Nanticoke in the testing in Sussex County, and of course Christiana Care and the Moores and St. Francis and the VA up here in Newcastle County, but particularly in Sussex County this week and last. Just an incredible job there. So the interim steps that we announced yesterday are allowing small business to expand their services starting this morning at 8 a.m. and we'll continue to look for ways to allow that to happen. These interim steps came from dialogue with small business owners themselves and members of the public through the virtual town hall meetings that I talked about, through their interaction with Damian DeStefano and his team at the Division of Small Business, Secretary Bullock and all. They're just doing a great job, and online feedback that we have received as part of the virtual town halls and as part of our public outreach. So the goals of the interim steps are really to provide economic relief for those businesses in particular and for Delaware citizens. And I know I had the restaurants again on the line the other day, and we talked about the federal PPP program and its limitations. They have to make sure that those resources are out the door by a date certain coming up, and that's a challenge. We'll be talking to our congressional delegation about that, and our help program that is a interest-free loan for small businesses that we've increased based on the feedback that we've gotten. Part of our movement to reopening will require maintaining strict guidelines with respect to health and safety as we prepare for phase one. And our target date for phase one right now is June the 1st. Again, in between now and June the 1st, we will be taking interim steps. Again, we are kind of modifying a little bit the guidelines that we received from the White House Task Force and the CDC in taking some interim steps leading up to phase one, and as we move from phase one to phase two, making determination based on the situation on the ground, the data and criteria that we're seeing in terms of the spread of the virus, any outbreaks that might occur, our ability to contain the outbreak in Sussex County, to stand up our testing initiative, which I'm very excited about, as well as the contact tracing. So again, thank you to all Delawareans for pitching in, for leaning into it, because working together, We've done that. We've brought that curve down. We're putting ourselves in a position to gradually reopen sectors of our economy and help those businesses be successful. And that's our number one priority, along with the health of the community. So with that, Dr. Rattay, we'll turn it over to you.
Great. Thank you so much, Governor. So before I jump into testing, I want to make a mention about the data that Governor Carney went over, and want to remind people that not only if you go to My Healthy Community, so Google My Healthy Community is a good way to get there, you can also go to de.gov/coronavirus. We have now embedded My Healthy Community into the homepage of de.gov/coronavirus. So from there, you can get to an increasing amount of data. We're going to continue to build upon the data that are available to Delawareans to see what's going on, in addition to the dashboard that Governor Carney mentioned. I really want to say thank you to our colleagues at DEMA, AJ, and your team for it was a lot of work to have the data, the dashboard that has been on the de.gov coronavirus page for the last 2 months, and really appreciative for all the work that your team has had has put into that. But now, when you go to our website, you'll see the My Healthy Community data and links to the My Healthy Community site. Additionally, when you go to de.gov/coronavirus, you will see a new look to that page. The Government Information Center did a wonderful job redesigning that web page, and so please go check it out and see what's new. So let's talk about testing. We are expanding our testing program. We've talked about that a bit at these briefings, knowing that because there's no vaccination, because there's no treatment, identifying people with COVID, and that also includes asymptomatic people with COVID, is going to be critical, so that once they're identified, we can help them safely be in isolation and identify their contacts and connect with those contacts to put them into quarantine. So testing is really a centerpiece of the work that has to take place. We have been testing over 4,000 individuals per week in Delaware. That number has been increasing steadily over the last few weeks, for sure. But we, according to the White House Task Force and the Centers for Disease Control and Prevention and a number of other reports, we've established our goal to be able to do 80,000 tests monthly, which is more than 4 times the current level of testing statewide. So we have done a lot of work to identify what's the best strategy to do that, knowing that we need to get more tests out there into the community. We need to especially focus on our more vulnerable communities, our low-income communities. And so we are really excited about the plan that we are announcing today. So we've talked about our amazing partnership with Delaware hospitals throughout the state, who have been really the backbone of the testing to date, and they will certainly continue to be key partners in both collecting the specimen, but also they have been playing a role in running some of the tests in their own hospital laboratories, which has been very valuable. As we move forward, we're going to be increasingly relying on other partners like primary care physicians and federally qualified health centers and pharmacies in the state to increase testing for individuals throughout our state. And in fact, an important component of what we have been doing and what we need to step up is called sentinel surveillance, which is making sure that we are testing both symptomatic people and asymptomatic people in a variety of places throughout the state, including especially with our more vulnerable populations. And so our primary care physicians and our federally qualified health centers and pharmacies as well are going to play an important role, as our long-term care facilities, in helping us to know what the activity of this virus looks like out in our communities. Where are we seeing elevated positive cases, and where do we need to enhance our efforts? So that Sentinel surveillance system is very important, but also partnering with a variety of community partners, including employers, is going to be important going forward. So testing is going to look very different in the upcoming weeks and months in comparison to how it has been looking. And a key piece to that has really been what tests have been available to us. You know, our testing supplies, our testing reagents have been fairly limited. And we are extremely excited about a solution that a Newcastle County executive, Matt Meyer, introduced us to last week. And so over the weekend, we got to learn more and then test this saliva-based test from an organization called Curative Corba. They're located in Los Angeles, although they have an East Coast presence in Washington, D.C., which is very convenient for us running our tests. These saliva-based tests are very easy to implement in community-based settings. They're quick. They don't require as much personal protective equipment. And also, you can expand the numbers of volunteers who can help us administer these tests, so we don't just have to rely on the healthcare system to do these tests. So we are very excited about that. Our testing is prioritized, of course, for symptomatic people, and we want to make sure anyone with really any of the COVID-like symptoms, which is, as we've talked about before, those symptoms have expanded to certainly more symptoms than just cough, fever, and shortness of breath. So any symptomatic people we want to make sure are able to get tested, but also those who are their contacts or who have been exposed to COVID-positive cases. We want to make sure that we can identify those individuals as either being pre-symptomatic, so before they develop symptoms, or asymptomatic, so that they don't spread the infection to other people. We also are going to be doing more sampling or oversampling in among vulnerable communities, including elderly Delawareans and members of low-income communities. This is really important. Important also that we're again not just looking at people with symptoms, but looking for asymptomatic infection as well. And that also includes certain frontline essential workers, people who have been out there in the public now exposed to either members of the public or working in situations where, for example, they're in tight-knit quarters. We want to make sure that that we make testing very available to these frontline essential workers. In our state lab, to date, we have done 3,312 tests. We are able now, over the past week, to expand our testing capacity. There's 2 specific instruments we have that now have FDA-approved reagents. So you will see an increase in testing in our state lab as we go forward, which we are excited about. We're also really excited about the number of tests that have been administered by our hospitals, especially in their community testing sites. So they are now over 34,000 tests that they have completed in these testing sites, which is a really great number. Thank you.
Yeah, so a couple things there in the testing. Obviously, a real breakthrough with respect to the 200,000 test kits. What we're finally referring to as the spit test or the saliva test will really give us the kind of capacity that we need to test all those subgroups, particularly those essential workers that have been out there through the shelter-in-place, stay-at-home order, working in essential businesses. And as you we announced the other day, testing all the residents of nursing homes to really lean into protecting the most vulnerable populations. And to do this, we've got a great team at public health. We've got great partners with the hospitals who've up to date have done the bulk of the testing at 34,000, and really over the last week, particularly leaning into the issue in Sussex County. We really need a point person to take this operationally, and I've designated A.J. Schall, who's the director of DEMA, to lead that effort on our side, working with our experts there at public health and really making that team of partners a lean, mean fighting machine operationally to deploy this new system. It's going to take a lot of work because you got a lot of tests we're going to get done, but it is going to be essential to our reopening and are essential to keeping Delawareans safe and essential to providing both customers of businesses now opening as well as workers in those businesses a level of comfort that the person that's next to them in the store 6 feet apart is, number one, 6 feet apart, number two, has a mask on, and number three, has been tested and we know is likely not positive.
Absolutely, and I think, testing has been one of those moving targets now for, several months, whether it's been the reagents you've needed, the lab capacity, the swabs that people in the field that can actually do it. So, with the expansion of what we've brought in state to just the testing capacity is going to let us have a layered approach and really expand that and get boots on the ground starting next week using some of these new tests. The layered approach is going to continue to use our hospital systems that have been, instrumental in being in moving forward. They've done, several thousand tests just down in Sussex County in the last few weeks. We expect those, that community testing that hospital systems have done to continue. We know we have our trusted organizations, West End and other organizations across Lorette and across the state that are going to continue to do their outreach. And now we're going to be able to bring in, that safety net to put over it to make sure we have a few things. We're able to go into high rises in Wilmington with the Wilmington Housing Authority and go through there and make sure we test some of those older individuals, make sure we have the ability to do fast throughput of testing, hopefully by the end of the month or early June, where we utilize, whether it's a parking lot or DMV drive-through lanes to get, 1,000 people in through a time that register. And there is a lot of stuff to be done next week to get this built. There's going to be some technology that will enable people to, make reservations, come, give us a confirmation number. A lot of your information is going to already be pre-embedded. You'll test yourself, and then we'll be able to get you on your way, and within 24 to 36 hours get the results back to those individuals. So it's not a one-size-fits-all for testing. We have to make sure it's right size for the community. We have to make sure we're using trusted partners, and we have to be able to, we're reaching those that may not think they need the testing, but they need to. So I think Dr. Rattay's point to utilizing employers and out-of-the-box ideas are just going to continue. We've talked about this for years in tabletops and planning assumptions we've had during other incidents, and now it's going to come to fruition. So next week we'll be doing two launches, soft launches with the curative test. One down in Sussex County, another one which will be more of a community pop-up type function up here in Newcastle County. So more to come on that. We'll definitely be keeping everybody apprised of how that's working out. National Guard. So I cannot say enough for these citizen soldiers. 5 years ago when I started in this position, General Vavel and I met within, I think, about 2 or 3 days of me starting, and the pride and flexibility and the way he talked about they lean forward is true today as it was then. And they have, I think, have over a dozen missions right now that they've been assigned to. Food distribution for schools, for the food bank, logistics with PPE, with preparing the care kits. We have medical personnel from the Guard that are in nursing facilities across the state to augment that those facilities to ensure that they are providing the best care they can for those residents. And starting next week, there's going to be probably a group of about a dozen individuals that are committed to our testing strategy to make sure we could go around and just keep on going. To get 80,000 a month is going to be a very high goal. I think it's going to be very hard for us to think that we're going to do that just with a one-size-fits-all mentality. So that's why across our communities we're going to have to utilize all of them. So again, a lot of thanks to our Delaware National Guard as they've, they bring the muscle and they bring the fun trucks and all that stuff to our events. And right now they're bringing a manpower and woman power that we just wouldn't have if it wasn't for them. Lastly, talk about mental health. We talked about this 2 weeks ago. Last week, our major disaster declaration was updated from the president and FEMA to include crisis counseling. We have been working with DSAM within Delaware and then our federal partners to expand those options. And so, we understand that the impact of this is going to be around, longer than this virus is, hopefully. We hope the virus becomes under control soon, but we know those individuals that either unemployed, have dealt with a sick or sick of a loved one or death of a loved one is going to impact them for a while. And there are support services out there. A few weeks ago, they launched, the text option. They have community groups and other agencies able to help at helpushere.com. And those programs will be expanding in the near future as we develop more specifically for COVID. So if people need someplace to go, you could text DE Hope to 55753 or to go to helpusherede.com. And again, the team over there working with our federal partners is just going to expand that as these additional programs become available for Delaware and are built for Delaware specific communities. So with that, I'm going to turn it back over to the governor. Thank you, sir.
Yes, I want to thank AJ for all the work that he and his team have been doing over the last 2 months. The work you have ahead of us, AJ, is going to be an even bigger challenge.
Yes, sir.
As you pull together your operational team, as you coordinate with the contact tracing team, first led by our National Guard, and then with our in-house team. That's a lot of tests that you have to, deliver. That's a lot of coordination with our partners, particularly our hospitals, which have been just a steadfast foundation of this operation. And so we're going to count on you and your team to deliver there. Before we move into questions, I just want to recognize this is Public Service Appreciation Week. I want to recognize all public servants out there, those of you who've chosen to sacrifice and have a career in public service, whether it's in law enforcement, whether it's in finance, or whether it's in healthcare, social services, education, you name it. It's also Teachers Appreciation. We all have our favorite teacher. Usually this time of year, we have the Teacher of the Year event coming up in the later spring, and obviously that won't happen this year, at least not with a big dinner that we normally do. We recognize the anniversary of Delaware bankers, financial services industry in our state, really a core part of our economy. And of course, just a week or so ago, we had Nurses Recognition Appreciation Day. And if ever there was a time to recognize and thank our nurses, it's now, as a frontline workers in the testing and care for people that are sick with COVID-19 and those who are in the hospital and those trying to stay at the hospital. And then finally this week, maybe I'll wait till we close, we're going to celebrate our mothers on Mother's Day, maybe the first time ever that we didn't have a big dinner together with Mom. But I know my family will have a big celebration, and I'll refer to that again as we depart today. So now I'll just open it up to questions. I know they've mostly been submitted online, and we look forward to those.
Good afternoon. The first question is from Sam Green at WDEL, and you answered a little bit about this earlier, but he's wondering if there's anything that might keep you from making that decision to begin phase 1 on June 1st, specifically.
Yeah, so the two questions really are behind that. One is, can you open sooner? It looks like you have a 14-day trend already, and to that I would just say, our everything is trending down, but we have this really challenging situation in Sussex County. The actual day-to-day number of positive cases is trending up, and so we've corrected for that for the number of additional tests based on the percent positive. which is a trending down, but total cases still moving upward, and particularly concerning there in Sussex County. We're hopeful that the data that shows that has not resulted in a higher hospitalization rate is a good indicator in terms of less seriousness of the disease there. We hope it's not a function of people not going to the hospital for whatever reason and staying home even though they're sick. And so we continue to look to see those trends heading in the right direction. We continue to look to see all those dashboard measurements, PPE, our ability to protect hospital capacity there, which I still feel very comfortable about. I think AJ does too. We do have resources a little bit out of line geographically, but there's enough flex there. And then, of course, our testing and contact tracing. We have two good plans now. We've got the equipment on the testing side, which I would have thought I was really worried about, but I'm encouraged by that purchase. And again, thanks to the county executive for helping there. And so I remain optimistic, and we'll look at ways that we can enact interim measures to allow people to do some business possibly prior to June the 1st, and looking at that as the target date for phase one. We've got decisions to make mostly around the beach communities coming up, and some big ones there, and particularly given and looking at what's happening on the other side of the Maryland border in Ocean City.
Speaking of the beach community, Karen McGill at Coastal Point Newspaper says, what are your current thoughts on reopening the beaches? And are you looking to Ocean City to see how its reopening is going before making any decisions on the Delaware beaches?
Yeah, I had a conversation with Governor Hogan after the mayor of Ocean City came up with a surprise announcement to open the beaches in an unfettered way. It turns out he walked back, the mayor walked that back a little bit and said that they would only be open in a more limited way and only for Maryland residents or Ocean City residents, something like that. But yeah, we will be looking at that. A lot of these interim measures that we're taking are a way to gauge a public reaction with respect to the beaches. I think the best, we're having a conversation with the beach mayors. As I said, I was on a conference call with all of them yesterday. They sent me a letter earlier in the week requesting both caution, concern for having a different approach in Rehoboth and Bethany because of their, the number of people they get on their beaches and because of the boardwalks that they have there. One of the considerations there is if you keep some open and some closed, you might make the situation worse on the beaches that are open. I think in any case, we'll look for an interim measure, not full out, turn the switch back on and let everybody rush to the beach. I'm not sure that's a good way to approach it, but we're still looking at it. We will look at the effect there in Ocean City and see if that provides us any guidance.
The next question is from Amy Cherry at WDEL. She says, we're seeing a state like Nevada, which is in far worse shape than Delaware when it comes to overall cases and even trends, expected to begin phase one of reopening tomorrow. Is Delaware further hurted or halted from beginning phase one because of its proximity to New Jersey and Pennsylvania, who have both fared worse with coronavirus scenarios?
Yeah, I don't know that that's my considerations with respect to New Jersey and Pennsylvania. Of course, New Jersey, the real problem is in northern New Jersey. And so there is some geographic distance there. We are, I-95 and the Amtrak Northeast Corridor does intersect our state in the northern part and most populous part through the city of Wilmington and right by Greater Newark there. So that's a concern mostly in the border line activity. And one of the big questions for us is the 14-day quarantine for out-of-state travelers and when we lift that. And I think, you have two different issues there. In the northern part of the state, you have people coming back and forth over the border to shop at different stores that they like. And in particular, Pennsylvanians coming to Delaware for tax-free shopping. On the southern border, you have the beaches and the draw there both the southern and western border, and so different considerations there. And we'll be thinking about those things. One of the areas where the mayors were in agreement is for their business owners and tourists and second homeowners, they'd like to see a specific time deadline or trigger so that they can plan around it, and that makes sense. Of course, it makes it difficult given that we're looking at these factors that could change, a day-to-day, week-to-week basis. So we're using that as a target, and in particular, we will be looking at that out-of-state quarantine in terms of whether it makes sense. And then the other thing we're looking at, we wanted to do the beach thing in coordination with Maryland, and the mayor of Ocean City kind of jumped the gun on us there and surprised, I know, people over in the governor's mansion as well. On the northern border, again, you don't see as many cases or intensity in South Jersey. Pennsylvania's problem is in the southeastern part of the state, and so we'll be following what Governor Wolf and Governor Murphy did. It's important to point out that in Pennsylvania, they shut down construction and manufacturing. We didn't shut either of those down. So there's a kind of a big difference there in terms of what the shutdown actually looked like on each side of the border.
The next question is from Johnny Braxton at 6ABC. On some businesses opening today with kind of your soft process, is this a test to see how things will go going forward?
Yeah, it's fundamentally an opportunity to give businesses a chance to open in a way that's safe and get them some revenue. I mean, we just need to help these businesses so that they can sell their product, so they can get back in business to get revenue to survive, pay their rent, pay their employees, all of that. But it is, too, a way of slowly reopening the economy to see how people react. Because remember, the goal, we'd open tomorrow if we had some level of comfort that people would follow social distancing. They could, that all the conditions would be there to make that possible. But as we saw at the beginning, when we had to close the bars and restaurants down just before St. Patrick's Day, you might remember that weekend was a beautiful weekend, and the beach bars and restaurants were packed, and people were just kind of out of control with respect to social distancing, and forced our hand to ordering that those businesses be closed just to protect public health. And so we don't want to see that on this side of it. After all the sacrifices that Delawareans have made, and particularly the economic hardship that's visited upon our small businesses, we certainly don't want to reopen in a way that's not smart and safe. And either customers not come to their businesses because they don't feel safe, or too many people come and we have a serious outbreak on the other side that we have to act and close things down again. To me, that's the worst case scenario.
The next question is from Amy Cherry at WDEL. She says, we're hearing from shops that you've permitted to reopen this morning, that guidelines are so stringent that it may not be worth it for them to reopen. Clothing shops in particular are angered by the curbside pickup restriction. Meanwhile, people can buy clothes in places like Target and Walmart, as you mentioned earlier. What do you have to say to those small business owners?
Yeah, I agree with them, and I think those will be situations that we'll continue to look at in terms of lifting and giving relief on an interim basis, as we move forward. The test is really, it's really, can we, first of all, the bias is towards trying to do something that enables someone to open in a way that makes sense. Obviously, it doesn't make sense if their payroll costs are greater than the revenue is going to be. That just makes the matter worse. But if it gives them some revenue in a way that where they get net revenue, I guess, then that's something that we'd like to do, as long as we can do it safely without compromising the public health side of it. And I think I've seen incredibly, and on our restaurant call the other day, I just heard some really interesting and creative approaches to it. Whether they work, Economically, I think we'll have to see. I think it's a test on both parts. It's a test on our part from a public health side, and it's a test on the part of businesses to figure out whether they can make it work. I've talked to restaurateurs who've been able to make their takeout business work. Not many, but there are some, and the businesses are going to be different, and the reaction of the public is going to be different. I think some of those restaurants and bars and maybe Dewey Beach are going to have a very different kind of reaction than maybe the restaurant where my mother likes to go.
From the Delaware Public Media, is the state doing any additional enforcement of the businesses that were allowed to open on a limited basis today, or is the state largely relying on people to self-police?
Yeah, largely we rely on people to self-police, and the enforcement has been serious but respectful, trying not to go too far, obviously, and to get voluntary compliance. We've talked a lot about that with respect to how do you enforce whatever conditions you impose as you open beaches. You know, how do you keep people out of the water? How do you limit the number of people on the beach? A lot of us know that if you go to beaches in New Jersey, they have ways of doing that, and they have, teenagers or young adults, young college students who go around and enforce those restrictions, and they do it in a way that the people follow. So again, I think we need to be creative. We need to have enforcement that's respectful, that acknowledges that this is a pandemic creating risks and harm. And so I think if everybody, and I think most people, I tell you, I circulate as I drive around and see here in the city of Wilmington, and most of the people that I see on the street are wearing masks, even though and doing certain things in a way that's wouldn't require mask wearing because they're out there by themselves and not in a park with appropriate where it's possible to keep a appropriate 6-foot social distancing measure. So it does rely on voluntary compliance, but I think we'll have to think about enforcement, particularly around the out-of-state issue and the beach issue.
Along the lines of the enforcement question, Sean Green at WDEL says the Texas Governor Greg Abbott banned jailing as a punishment for violating COVID-19 orders yesterday. Delaware's rule currently includes up to 6 months in prison as a potential punishment. Would you consider making a similar decision?
Well, I don't think we need to do it with any kind of an executive order. As a practical matter, the number of arrests is way down. There's a lot of pressure on releasing inmates that would be safer in the community and are close to the end of their sentence and that wouldn't pose a risk to the community. I know that our probation and parole folks are not detaining folks in our correctional facilities out of concern for that, so it wouldn't make sense to incarcerate somebody for violating some of these rules. Now, having said that, we're serious about it. And if people want to be belligerent about it, that's not going to be helpful.
Karen McGill at Coastal Point Newspaper asks, have you, Governor Carney, been tested for COVID-19? How many times? What were the results? And are your staff members regularly tested?
No, I've not been tested. I'm not aware of staff members that have been tested. The test, up to this point, up to our announcement today, we've really tried to focus those on people that are symptomatic. I tell people jokingly that as a 63-year-old, when I wake up every morning, I feel some of those symptoms in terms of body aches and the like until I have my coffee. But no, I've not been tested.
The next question's from the Delaware Public Media. Was the decision to move the primary made in the hopes that in-person voting would be safer later, or to give the Department of Elections more time to prepare for the significant increase in absentee voting, which is likely to occur? And is Delaware prepared to handle what could be a huge surge in mail-in votes and a much greater than planned usage of the new internet-based Democracy Live platform that's being piloted in this primary?
Yeah, number one, I've tried to stay out of the decision-making as governor over elections, just so as not to create any appearances of political interference. Most of those decisions have been made by our elections commissioner, and Anthony, I think, has done an excellent job working with the Department of Justice with respect to legal authorities and working with my staff in the governor's office. But yeah, my understanding is they're ready, and part of that, and they feel like they can, are prepared to process a significantly higher number of absentee ballots. And the answer to your first question is, yeah, they push it off so that they can be better prepared to meet those both in-person voting as well as absentee balloting. You know, our objective is to make sure that nobody is deterred from their constitutional right to vote. It's an important right. It's one that people have fought and died for. It's one that's special in our democracy and one that we need to protect. And many Americans have shed blood to do that. And so, yeah, it's both to maximize the opportunities to vote, and the commissioner believes that they'll be able to do that.
Our final question for today is from Sean Green at WDEL. He said the Delaware State Parks have resumed charging entry fees starting today. Any indication what changed to cause this decision to flip?
Yeah, the initial reason for not charging, first of all, we would charge normally anyway. We do have special rates for certain populations, those that are unemployed and others. But part of it was, going back to the question of a minute ago with respect to beaches and out-of-state visitors was, it's a small thing, but creates a little bit of a deterrent for folks from coming out of state to our parks and beaches. And so we decided to kind of go the other way on that. And frankly, I think it makes sense. I think we should think of everything that we can do over the next several weeks to limit activity in the beach communities to Delawareans, people who have second homes there, so as not to overburden the beaches, the beach communities, and make it difficult for folks to observe appropriate social distancing. Well, we certainly appreciate all the questions and the participation and attendance of the media at our press conferences on a biweekly basis. Again, the message of today is that we had started off with some really bad news in terms of the shooting at our Veterans Cemetery, and our prayers go out to all those involved, particularly our law enforcement officers responding to that terrible situation. But good news and cautionary news with respect to the improving situation in our state with respect to our criteria for reopening. Thank you for the engagement, small business owners and local community members in our Zoom town hall meetings, to our Lieutenant Governor for getting all that input, for all the various groups that we engage on our conference calls, the mayors, the elected officials, the Association of Coastal Towns, the mayors down there. We make these decisions after sifting through all this input that we get and trying to strike the balance where we can accomplish a healthy community as well as a healthy economy. We're moving in the right direction, and we're moving in the right direction because we've stayed together on this. We're going to be more successful if we stay together. We're going to be more successful if we follow the orders to stay at home, to continue to wash your hands, wear a face covering when you're outside an essential business, protect your neighbors and elderly citizens. So thank everybody. Have a wonderful Mother's Day to our mothers out there and our grandmothers and my mom, 89 years old, God bless you, and Buckley Carney for raising 9 children and all these grandchildren. It's a shame that we won't have a big in-person celebration with you there, but we'll be thinking about you and thanking you for your wonderful love and care for all of us.